welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are the latest reports from the world of medicine. Gender differences in hypertension control widen with advancing age. Cardiovascular disease is the leading cause of mortality and disability, adjusted life years among men and women globally. In a recent study, researchers have found wider gender disparities in hypertension control, especially with patients aged 75 years and above. The study that has been published in the American Journal of Preventive Cardiology suggests that after age 65 years, women are less likely than men to have controlled hypertension, and sex differences in hypertension control were independent of obesity and diabetes. More research is, however, needed to determine the reasons for these age and sex differences in hypertension control. However, quality improvement programs for BP control should include targeted interventions for older women specifically to reduce their risk for cardiovascular disease and mortality. Patients with thyroid eye disease at increased reoperation risk after strabismus surgery. Now, strabismus surgery is the surgery of the extraocular muscles to correct the condition of strabismus, which is the misalignment of the eyes. Thyroid eye disease, also known as the thyroid-related orbitopathy, is a typical sign of Graves' disease, a systemic inflammatory condition. The thyroid gland, the pretibial skin, and the orbit are all affected by this process. Ophthalmic symptoms occur in up to 50% of Graves' disease patients, and patients most typically appear in their 3rd to 5th decade of life, with women being more commonly affected. A new study published in the American Journal of Ophthalmology shows that after a strabismus surgery, approximately 1 of every 4 patients with thyroid eye disease requires reoperation. The number of muscles operated on was the sole independent predictor of reoperation and the time to first reoperation. Researchers developed low-cost mobile portable magnetic resonance imaging machine for detecting brain disorders. In modern healthcare, MRI is a key diagnostic tool and often allows for imaging soft tissues inside the body, giving doctors a whole view without cutting. However, they are also expensive to operate, are loud, cumbersome, and a nightmare for claustrophobic people. The researchers team from Hong Kong have developed a low-cost portable MRI machine that does not need heavy and expensive shielding and is even able to still diagnose the brain disorders. The study that is published in the journal Nature Communications talks about how this new machine was tested by using patients who were previously diagnosed with brain injuries or impairments and found it to be capable of producing images that were good enough for diagnosis. A less expensive version could potentially save millions of lives every year because millions of people around the world live in places where MRI machines are still cost prohibitive. Will higher selenium status prevent cancer risk? The past studies showed that taking selenium as a supplement helped prevent people from getting cancer. According to a new study, having a high selenium level may not prevent the development of cancer. The links between kidney cancer and multiple myeloma might be confined in well-powered investigations. As the evidence for a link between selenium and cancer risk is ambiguous, this study, which is published in the International Journal of Cancer, aimed to investigate the links between selenium levels and 22 different types of cancer as well as any other type of cancer. In conclusion, the overall findings suggested no preventive effect of high selenium status against the development of any type of tumor. Beta blockers tied to lower mortality in patients with sepsis. Most studies found a benefit from beta blocker administration in sepsis. This included improved heart rate control, decreased mortality, and even improvement in the acid-base parameters. Now, chronic beta blocker usage in sepsis was always associated with improved mortality. A recent study published in the Journal of Intensive Care Medicine has highlighted that the beneficial effects of beta blockers in sepsis patients is proven. The study found pre-morbid beta blockers to be associated with lower short-term mortality in sepsis patients. However, there is a need for further studies on the interactions of beta blockers with their receptors to fully verify their impact on the outcomes of patients with sepsis. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.